You need teeth to chew. Simple as that, right? So there are three functions of the teeth. One is chewing, eating your food. Second is aesthetics, having a presentable, nice smile. And third is speech.
One of them is electric toothbrush. So what is your take on that?
So what electric toothbrush does is you just have to place it in position and the brush will rotate, oscillate and it will do the job. Alright. So it's not a bad device. Alright, but it is not that you are not going to brush well with your routine regular toothbrush.
Bleeding gums.
Yes.
How serious is it?
So you can say it's quite it's serious. Okay, there is nothing like is it very serious or it is less serious. It is serious. The fact that your gums are bleeding means there's I'll tell you what, Firdaus, this DIY thing, it is fantastic in everything apart from your health.
Health, correct.
Or a possibility there's a cavity which is lodging food which is rotting. Alright, that can give bad breath. Adapted by everybody to scrub the teeth in horizontal fashion, but our teeth are not, as I said, geometric. They are circular, they are having concavities and all. So having a circular motion is more effective.
विजडम टूथ निकाली तो आपके बाकी के पूरा स्ट्रक्चर खराब हो जाएगा या आपके दांत हिल जाएंगे, दूसरे दांत मिल जाएंगे.
अगेन मिथ बस्टर, ये ऐसा कुछ होता नहीं है. विजडम टूथ निकालो और बाकी सारे दांत खराब हो, इट डजंट हैपन.
काफ़ी लोगों का मानना होता है टूथपेस्ट में बहुत सारे केमिकल्स होते हैं, उससे अच्छा है आप दंत मंजन या टूथ पाउडर यूज़ कीजिए.
अगर हम कंपेयर करें तो टूथ पाउडर में ज़्यादा अब्रेसिव मतलब उसके जो पार्टिकल्स है वो थोड़े बड़े हैं, तो दे विल कॉज मोर फ्रिक्शन ऑन द टीथ, जिससे दांत ज़्यादा घिस जाएंगे. तो डेफिनेटली नॉट टू बी यूज्ड. इज इन देयर वेरी फ्यू नंबर ऑफ पेशेंट्स हु मे हैव हार्ट ट्रबल्स which may be related to the dental, but that number is so small it cannot be generalized to all common public.
What's up, guys? Welcome to Men Unplugged, the podcast where we dive deep into conversations that challenge societal norms, break stereotypes, and shed light on topics that aren't openly discussed, especially when it comes to men. I'm your host, Firdaus Mudassir, and today's guest is a powerhouse in the world of dentistry. Someone who is not just shaping smiles, but redefining how we look at men's health as a whole. So ladies and gentlemen, our guest today is Dr. Tejas Mhatre, one of the leading dental surgeons and implantologists in Mumbai, with over 12 years of experience and expertise spanning across 25 clinics. We are going beyond the dentist chair today to discuss dental myths, essential do's and don'ts for your oral health, and how men often overlook their well-being. We'll also touch on mental health connection and subtle societal pressures that make men neglect their health. This is going to be a no-filter conversation, power-packed with exclusive knowledge, so buckle up. Welcome to the show, Dr. Tejas.
Thank you.
Dr. Tejas, let's directly get to the first question, which is very controversial in nature itself. They say that, you need to brush properly and you only go to the dentist when your tooth hurts. Okay, but we definitely know dental health is much more beyond that. It is not only about when your tooth is hurt, and your oral health doesn't speak only about that. So if I have to ask you, how does dental health lays a pathway for your overall health, or is a pillar of your overall health? Would you like to elaborate on that?
Yeah, sure. So I would not call it as a pillar. I would call it as a gateway to your health, right? Because for you being a healthy individual, you need to have a good nutrition. Nutrition comes from food. You need teeth to chew. Simple as that, right? So there are three functions of the teeth. One is chewing, eating your food. Second is aesthetics, having a presentable, nice smile. And third is speech. All right. So if you are not able to have a good nutrition, you're not able to have a good food, all right, your all other metabolic problems, all other health issues, that's how it starts. All right, so that's why I would say it's a gateway to your health, not the one of the pillars.
So Dr. Tejas, they also say that some bodily functions, and there is a high, I don't know whether that is a myth or that is something, or it has some great scientific relevance. They say your dental health or your oral health, whatever you may call it, also is somewhere related to these problems like heart attacks and stuff like that. So is there a correlation between them, or is there a relation of any?
No, there isn't. There are very few number of patients who may have heart troubles which may be related to the dental health, but that number is so small it cannot be generalized to all common public.
But
There are some patients who are having some disorders like heart wall troubles, valve replacements. So those are the people who are having connections, having a poor oral hygiene, poor health, which may trouble their heart. But it cannot be a statement which can be passed as a general public. For sure.
So does that really have any effect? Like जितनी knowledge मुझे या जितना experience मैंने किया है, if there is any problem in the mouth, okay, whether it is about your bad breath, your root canal, or some sort of issue in the, I always felt it was limited only to your mouth and this particular area. Does it go beyond this also? Like if you have any dental issues?
They are very few number of patients, Firdaus.
Okay.
So how it goes is, this is very true that dental problems are mainly local problems.
Okay.
Very few number of patients, I would say less than 1%, would have systemic implications to them.
Okay.
All right. So they are systemic implications in the sense, as we just spoke about, some patients who are having heart troubles, all right, and having poor oral hygiene, those bacteria may enter the bloodstream and cause trouble in the heart.
Okay.
But it doesn't happen to general public. They are very selected patients.
Right.
If at all we are going to focus on general public, a good oral hygiene is important in the sense that they are inefficient in eating if they are not having good teeth. All right. Inefficient in eating causes poor nutrition. Poor
Right.
nutrition may cause poor health.
Right.
All right. People do become selective in eating their food. All right. So the nutrition is never complete. They don't eat raw food like salads. They don't. They avoid fruits like apples, guava. They don't want to bite into hard foods because their teeth may hurt.
Right.
So they start selecting finer food products which are easy to swallow, easy to gulp, requires less chewing efficiency, but they may not be fulfilling their nutrition. Selecting these food items.
So basically, it is the nutritional deficiency that they may get into
Yes,
because
yes.
of not having healthier teeth.
Yes, that would be the starting point.
Starting point.
That would be the starting point.
The way the gut has been now one of the most controversial topic these
Yes.
days, where they talk about your gut is your second brain and how important it is for. Does any way your dental issues have an impact on your gut health also?
So, if it again is the same statement that I would be passing, yeah,
Right.
because if you're not having enough nutrition, there is no much stimulus to your stomach, your intestines to produce the secretions that they are supposed to produce. So overall, the gut health may deteriorate.
Okay.
May deteriorate.
Because of the nutritional deficiency.
Yeah, but that is only the starting point. You know,
Right.
your dental health is only the starting point.
Okay.
Patient may be callous about it any which ways.
Right.
Right. They may
Right.
be callous about it any which ways. So
Right.
we cannot focus that, oh, you're not having good teeth, you're going to get into a heart attack.
Right.
You're not having good teeth, you're going to have diarrhea. That correlation cannot be
Established that evidence.
That's right. Yes,
Okay.
yes, yes.
So, doctor, if I have to ask you, what are the quick 5 tips that you would suggest to our viewers and our listeners for maintaining a good oral health? What would it be for the adults, especially right now?
I would say 4 rather than
Okay.
5 because there aren't, the dental problems are so small, so we don't want to complicate it.
Right.
Right. So the first and foremost is brush twice. Okay. There's a logic behind it. So there is something called as a biofilm, which is full of bacteria, which keeps on forming every 12 hours. Yeah,
Okay.
we have 24 hours in a day, so brush twice. Now, when you clean your teeth, you are not able to clean all the surfaces, especially the contact areas. That's
Right.
where the second tip. Please floss your teeth. All right.
Okay.
Use any flosser. Yeah, either manual. There are some with the handles, water flosser. There are many devices available in the market. Whichever suits you, use it. Third is use a good mouthwash so that your microorganisms quantity is kept in a check. All right. It's impossible to have an absolutely sterile mouth, but you don't want overload of microorganisms in your mouth. And fourth is have a regular checkups with your dentist because
Right.
dental problems are so slow. They are so slow. We call them chronic problems. They are
Right.
very rare acute problems. Emergencies happen after a delay of more than a year, year and a half.
Oh,
That
is it?
Yes. So people are suffering, but the problems, the extensibility of the problem is so small that they don't attend it so quickly. So
Right.
till the barrier is crossed, till the line is crossed, and now you can't wait at home.
Right.
All right, but the event has started really long back.
Way back.
It always starts with a small point. It magnifies. Then a day comes. Now I can't sit at home.
Right.
All right, that's when emergency occurs. So visiting the dentist maybe 6 to 8 months for certain quantity of people who are susceptible to problems, or as a general rule for a general public, once a year.
Irrespective you have pain or not, you should see your
Absolutely.
dentist at least
Absolutely.
once a year
Absolutely.
to make
Absolutely.
sure that your entire dental
100%.
health is
So that's
fine
a
or
general
not.
rule. Once a year for general public.
General.
We identify certain people. Oh, you are going to be susceptible to problems. Please see us earlier so that we can catch it quick. If at all there's any small trouble, small problems, small solutions, easy.
Correct.
Yeah.
Makes sense.
Big problems, complicated solutions, very difficult.
Right.
The job is difficult for me, it's difficult for you.
Now we come to the part of the toothpaste. Abhi, there are so many toothpastes available in the market. There is, I mean, I'm sure you will not name any, but hum toothpaste select karte time, what is one thing that we have to keep in mind?
I would say just use any toothpaste which comes from a standard company.
Okay.
All right, they are checked very well by Indian Dental Associations. They are FDA approved. Don't use any random toothpaste which nobody has heard of. So the action of brushing twice is more important than what products you are using.
Oh, okay. Okay.
All right, brushing twice is products become important for again very selected number of patients. Like some patients we see they are getting aggressive troubles. All right, then we are very specific. नहीं, आप ये use करिए. Please don't deviate from this product. All
Okay.
right, but the fact remains people are not brushing twice. People are brushing once and expect miracles to happen. Doesn't happen.
So, doctor, these the remedies that are easily available over the counter, like teeth whitening toothpaste and charcoal toothpaste and stuff, do they really have any relevance, or as they promote themselves to be, or it is as good as a simple toothpaste?
No, the ones, especially the ones, the whitening toothpastes and all, we as a dentist, we don't recommend, don't do it over the counter because it's not a controlled environment.
Right.
Okay, when we do some whitening procedures in the clinic over the chair, they are completely controlled environment. We know how much to do, how to do, and when to do.
Right.
So when you're doing, there are some products which are available over the counter for whitening. All right, with a guideline.
Right.
But then we will not call it controlled environment because it is absolutely up to you how you are doing and what you are doing without any training in one shot. So you are going to be a guinea pig for yourself. So
Right.
then we don't advise DIY.
Right.
It's
Do it
it's not
yourself
the
is
it's not the best idea. Then there are some treatment modalities wherein aligners for teeth straightening, not exactly DIY, but again uncontrolled. Like they would come home. Some of the companies they are not dentist oriented; they are company oriented.
Right.
They would come home, scan your teeth, and provide aligners. I think they have been restricted by the Indian Dental Associations also now.
Okay.
So we don't recommend them because there are no follow-ups. It goes unchecked.
Right.
How the treatment is going to end, it goes unchecked. So it actually becomes a bad name for the dental field and dental fraternity. Oh,
Correct.
this doesn't work. I don't
Right.
think we should be doing this at all.
Right.
All right. So if it is not guided or monitored properly, things are mostly will go wrong. And if they go wrong, then that treatment modality gets a bad name.
Correct.
Okay, so in the best interest of the dental fraternity, DIY should
Be avoided.
Yeah, dental fraternity and general public. Yeah, we
Right.
we are always going to be as a team, the patient and the doctor.
Correct.
So as a team, we should not do any DIY
And also
apart from toothbrushing. you possibly can't come twice
Correct.
a day to our
to
clinic
the
to get
clinic
your
and
teeth
get it
brushed.
done.
Yes.
Right. So basically, you need to be more health oriented in the sense all the treatments that you do should be supervised by your doctors or should
Absolutely,
be under the
absolutely.
guidance of your doctor and not to be
Absolutely.
taken from just the brand. Right?
Correct.
Okay.
Correctly. It's best to understand what you are getting into.
Correct. Because it's about your health.
Yes.
So, doctor, next, if I have to go to a question regarding dental health is, these days, due to the accessibility of various kind of products, the sugary products, the consumption of something like chocolate spreads and something of a particular brand which have extremely high sugar levels in them, and kids are super addicted to this.
Absolutely.
So, what would be your tips for parents or for the kids when it comes to their oral health?
Oh, okay. See, the difficult one because it's impossible for anybody to keep kids away from everything.
Right.
ये हो नहीं सकता है. Like for that matter, phone also. You can't keep your kids away from phone. you're going to be a part of the society, you're going to be a part of the system. It is there. All right, so it's not a bad idea to keep a ground rule. Yeah, you can eat so and so on so and so day, only this much quantity.
Right.
All right, or you can have some ground rules that these are the only products that you can or cannot have. All right, binge eating, snacking, especially for for kids going to school,
Right.
having their snacks full of only chips or only processed food. So not a great idea. Not just for dental health, overall health.
Overall, of course.
Overall health.
So if I have to say, just parents need to ban these 3 kind of products for kids, what would that be? I know I'm getting you into some sort of...
I'm not part of banning. It's a very strong statement to ban.
Right.
All right, because they are any which was available in the market, and kids nowadays what? Even when we were kids, we are smart enough.
Right.
Figure out a way.
Right, to get
if
reach
you don't
that.
have access, you find another way to do it. So you rather do it, but do it in front of us.
Right.
Yeah, you eat in front of us. We keep it under check. Same as don't do it DIY.
Right.
Yeah, do everything in front of us, no problem.
So there's nothing
so
to ban from the dental health perspective, but then everything has to
Yes.
be under quantities
Yes.
and under
So we will call there are
supervised.
some food products which are really damaging, especially chips. All the snacking items, they have a tendency to stick to the teeth.
Okay.
All right, and if you're not brushing, well, not brushing twice, not brushing well, not flossing, having food products, sticking to your, food, it's a recipe for disaster.
Right. Right.
Right, so everything has to go together. But let's not stress too much about it, because
Right.
in the entire body, teeth are a small product, important, but very small, organ.
Right.
Yeah, so there are too many things that kids are going to be wanting to do or not to
I'm
do.
curious about it, of course.
Absolutely.
So, to my surprise, I was looking for an answer like, keep them away from chocolates since they are the most harming ones. But to my surprise, you came up with chips. So, because chips generally are not sweet, and we have for all our lives made to believe that जो मीठा होता है वो दांतों के लिए खराब होता है. तो कभी किसी ने चिप्स या फरसान या इन सब चीज़ों की बातें नहीं की. So can you elaborate a little bit on how this is distinct and how it is more damaging to the teeth?
So ऐसा नहीं कि chocolates भी damaging नहीं है, but if you see the pattern of kids eating on snacking items, chips is the thing. Chips is the mainstay. People are eating chocolates, but if at all 2 chocolates are consumed, there are 10 chips which are consumed.
Correct.
And that is the reason chips.
Okay. Again,
Yeah.
due to the quantity that is
Quantity,
higher in
yes.
consumption.
Absolutely.
That is the
Absolutely.
reason it is going to be a little more damaging.
See,
to the teeth.
you see yourself, if you're traveling, you are going for a long drive kind of thing, you're going to Pune, you check what are you carrying for snacks. You're carrying chips.
Right. Right.
You're carrying chips.
So that
you're not carrying chocolates. Yeah, you may be, but chips are definitely there.
A part of it.
Yeah.
Totally makes sense. Absolutely makes sense. These are certain things probably did not occur
These are
to
practical
us.
problems.
Yeah, practical problems that doesn't occur to us in the general human being unless somebody from the authority talks about it, like somebody like you who absolutely monitors the dental aspect of a person. So, as we mentioned, now coming to a question which is a little gender based, I want to understand, I'm sure you see a lot of patients coming to your clinic and I have witnessed that myself. What is the kind of ratio that you usually feel? Because the question that I'm getting over here is, do you think men are generally the ones who do not prioritize their health, whether it is dental or overall health?
It's partly true. Okay, we get equal number of males as well as females, but I see short treatments in men and long treatments in female. As in, all problems are definitely addressed in females, and not all treatments are addressed in males. Okay, that I definitely see.
So,
All right. So if I have 10 problems listed for person A, okay, and 10 problems addressed in person B. Person B in a female, I think 8 would be addressed and 4 would be addressed.
So what do you think is the basic reason that men do not address or prioritize their health? Because the channel that or the theme of our podcast is because we see a parity between we see a lot of discrimination when it comes to mental or general health of men versus women. I have seen, like, I do not even remember the last when my father said, okay, I need to get up and go to the doctor. But then I usually see if mama's head is paining or mama is not feeling good about something, the first thing she does is, oh, I'm not feeling good, I need to go to the doctor. So I always wondered whether it is something that is, papas are superheroes or something like that, that nothing happens to them. And, or, I mean, what is the concept behind all of this according to you as a man?
So I think my wife will also agree with you. Can't think beyond certain point.
Right.
Yeah. So long-term planning is not the best in most of the men, I think. If at all, short-term problems, short-term goals are more important than the long-term planning and long-term goals. So dental problems again are such that they are very easily ignored. All right. So immediate attention is given, immediate gratification is done, immediate problems are addressed. A step is taken back because it comes in a list of priority. I think health comes really towards the end, and dental health comes below that
For men.
for men.
So that is, they do not really prioritize or think about their health or dental health for that matter. And now coming to something more beyond dental health these days is mental health.
Correct.
And especially for men. And that is the reason we have this podcast where we want men to speak about, to let us know what they think towards the entire lifespan, that the journey that they have spent as a man, either being discriminated over some things or some history that they've never spoken about.
I think all problems occur equally in men and female.
Right.
Of course, there are variabilities. Okay, but the identification of problems, the self-realization of problems comes a bit delayed. All right, so the magnanimity of problem then occurs at a later stage, which is not impossible to solve, but maybe difficult to solve.
So it keeps piling up with men.
Absolutely.
And then when it is...
And as we were discussing earlier also, there's always a breaking point.
Right.
All right, but I think the breaking point has occurred, and the most of the men have stretched it enough that now it is irreparable.
Right.
All right, so you may be seeing mental health issues which are very delayed addressed in males than in females.
But then, of course, that destroys the equilibrium that we have in the society, and that is the reason where we talk about that men need to speak about themselves. They need to speak up for themselves. Not always the other partner or the other gender has to be in the forefront of receiving all the good, bad, ugly. Here, the men are also receiving a lot of them, but keeping it to themselves.
Absolutely.
And that is causing a lot of... So, doctor, if I have to tell you, in the recent times, we've seen that there have been a lot of suicide cases that men have committed. And one of the surveys that I came across, which was absolutely shocking, was there are 85% of the men who feel suicidal. Okay, they feel suicidal, and there are barely 10% of them, or maybe less than 10%, who speak about it. And when you actually look at the figures, it is more than 30% who end up committing suicides.
Those are huge numbers.
So this is huge. And then when we say men, under this garb of that we are wired to be strong. We are wired to be strong. We cannot break down. We cannot cry. We cannot crib. Under all of this, probably we are suppressing a man who would want to speak up. A human being, because before we discriminate or even distinguish between being a man and a woman, he's a human.
But I'm sure people, the mental health, the approach to mental health is slowly, but it is changing. Yeah, people are identifying themselves. Yes, I think I have a problem.
Right.
All right. There's a good possibility that the number of hours or dedicated towards that problem may not be enough. All right. Whatever said and done, we live in Mumbai, but all across India, the number of working hours that a man puts, is little more.
Correct.
As compared to
women.
All right, because as you said, it's the man of the family. Who's going to work for the house? The man is going to work for it. Doesn't, in today's world, these statements have got no meaning. But it still holds true in interiors as well, to a certain extent over here also.
Right.
Yeah, so ऐसा समझ लीजिए टाइम नहीं है ना, टाइम ही नहीं है. Okay, and जब टाइम मिलता है तब तक the time is past. After you retire and now I think I will focus on myself. Yes. But that time is lost.
Absolutely. There's a lot that has happened in this entire, because generally when we see, of course, being a woman, I realize that there's a lot of stress that both the genders face. Okay. But when it comes to the stress of the man, it amplifies only for the fact that he doesn't speak up.
Yes, and what happens is, I think there is a lot of answerability, not only towards your family but also towards your profession.
Correct.
Okay, and with both the ends are intertwined. You lose one, the other is also going to get lost.
Absolutely.
So you have to hold on to your profession to support your family.
Perfect. Yeah.
So यहाँ पर बहुत separation होता है, profession में बहुत separation है. You can't speak up. You have to bear. You don't have time for yourself, and then that stretches like like a rubber band, and one fine day it breaks and it is impossible to join back.
Correct. It's beyond, it's irreparable. It's absolutely irreparable. And that is the sad aspect of our society. So, sir, in this segment, I want to ask you about one of the major treatments that is widely available in the dental industry, which is braces and aligners. Okay, and also if you could share some light on its correlation or relation with mental health.
Okay, so it is generally perceived that braces or aligners are done for kids. Okay, not so anymore. Okay,
Right.
there is no age limit to it. That is first. So it is open to general public, and it's a very good treatment modality for realigning your teeth to have a better smile. Now, as you were trying to correlate dental and mental health, having a pleasant personality, having a pleasant appearance starts with a good smile. So having a better set of teeth, healthy teeth, and pearly whites, okay, it can be achieved with having braces and aligners as a treatment modality. Now हम हमेशा सोचते हैं कि बच्चों के लिए ही ये डेंटल ट्रीटमेंट ब्रेसेस का ट्रीटमेंट अवेलेबल रहता है, बट ऐसा होता नहीं है. ओके, वी सी लॉट ऑफ पीपल, हम काफ़ी ओल्डर जनरेशन देखते हैं, दे हैड अ विश, दे वो चाहते थे कि हमारे दांत बचपन में अच्छे हो तो कितना अच्छा होता था. वी वुड हैव बीन हैप्पियर हैविंग अ स्ट्रेटर टीथ, मे बी आई वुड हैव हैड बेटर प्रोफेशन, मे बी आई वुड हैव हैड बेटर लाइफ. Okay, and they still and yet come to us, not from health point of view, from aesthetics point of view, that I think this was my wish all my life and now I want it.
Right.
Alright, so we see those kind of patients who had long dreamt about having a good set of teeth, having a pearly whites, and didn't do it. Now they want to do it.
Right. So basically, there is no age for braces. You
No,
can
there is no age for
adapt
braces.
to it whenever you feel, or you.
Absolutely.
So this also gets me to a point, sir. Don't you think confidence is also related to the way you look and smile, especially when it is your smile?
So again, I will tell you an interesting study. All right, it was done in primary and secondary schools, wherein teachers who are supposed to shape the society, teachers who are supposed to have non-biased, unbiased, environment for their kids. So the study was done in with certain parameters, wherein the conclusion was kids having a good set of teeth were better selected for better projects. They were favored as compared to the kids or children who had crooked teeth. जिनके दांत थोड़े टेढ़े मेढ़े थे, they were not favored as easily. और ये कॉन्शियस डिसीजन नहीं था, ये सब कॉन्शियस डिसीजन था, ये ऐसा अडेप्टेशन था. they just did it without any mal intention.
Right.
All right, but this is what happens. Like, you have a good set of teeth, you have a pleasant appearance, you have a pleasant smile. I think you are the first one to get selected.
Correct.
Okay, as we were talking earlier as well, आपने बॉलीवुड मूवीज में देखा है गब्बर के दांत कैसे होते हैं, right? You have seen all the villains. They are either missing teeth, forwardly placed teeth. There are no rock stars. All the heroes, heroines, all the prominent personalities, if you see their teeth, okay, they are pearly whites.
Right.
So it's a society,
Perception.
what I can say, perception, wherein a bad face, a bad guy, a good face, a
Right,
good guy.
right.
Smile is one of it.
Correct. I agree.
Okay,
I agree.
smile is
to it.
one of the factors which helps in determining, okay, is this face a good face or is this face a bad face?
Correct. And it also, of course, as you said, unfortunately, yes, the society also pays attention a lot and then judges you based on these. And smile is definitely one. So, I've heard a lot about things like, once people, they want to get into some sort of public or media appearances, the first thing they do is get their smile and
That's
their
right.
teeth
That's right.
fixed.
It's a professional requirement.
Correct.
All right. There are various ways to do it. Having braces, having aligners, or having some smile redesigning. All right. If at all I have to jot it down as a which one would I select, which one we would want to
Recommend.
give as a recommendation, we would always say get your teeth realigned. Having a teeth which are given by God, okay, in a correct position will always have a longer lasting health wise
Benefits as compared to
yes, and it will be more stable as compared to something which is artificially reconstructed. All right, whenever we are putting some caps, crowns for redesigning, we are invading nature.
right.
Okay, it is very difficult to beat nature. All right, it is very difficult. You will be happier for a few years, you will be happier for a decade maybe, but then the problems are always going to creep up. So when we select a treatment modality which is going to invade nature, I think we have to be careful. All right, so if at all I have to select, even if it is a professional requirement, all right, we would want to select something which is less aggressive than more aggressive.
Right.
Something which is going to cause irreplaceable or irreparable damage, irreversible change is not what is preferred.
Correct. So basically, this term that is doing the rounds about, we have all sorts of makeovers. So the one that you're referring here is something that we hear largely about is smile makeover.
Yes.
So
yes.
as you said, something like a smile makeover is just a
No, so smile makeover has got lot of divisions. Okay, as a realigning is one of them. Putting crowns is the other extreme. Crowns are artificial ceramic crowns, caps. Ceramic also has lot of things which requires reduction of tooth structures, which are, as I said, irreversible.
correct.
I would not call it exactly as damage, but you are changing what was given. All right, and this change may or may not be acceptable.
Correct.
All right, in the long run.
Yeah, your body might end up reacting to something which you have
Absolutely.
artificially put in or something that you've tried to.
So ऐसे बोलने जाएंगे तो अपने पैर पे कुल्हाड़ी मत मारो. अगर मार रहे हो तो सोच के मारो.
One major thing that we just had a discussion on, that it was quite surprising that this kind of thing still occurs, is you told me that when kids are got to you for braces or aligners, you see a vast differentiation of age or distinction of age in terms of the gender. जो लड़कियां आपके पास आती हैं ब्रेसेस लगाने या पेरेंट्स जिनको लाते हैं, that is at a much earlier age as compared to the guys.
So on an average 8, 9, 10 years, 8 to 10 years is what we see girls coming in for checkups, for teeth being prominent, teeth being crooked, or in fact the teeth are perfect, but the parents' queries are, do you think? Do you think it is? In spite of the fact that everything is perfect. All right. And as compared to the boys, I think at a later age group, when they are able to speak up, that I think my teeth are forward. I
Right.
think there is something wrong with my teeth, where they are convinced, but it's not a rule, but
Right. Generally, that is what has been noticed.
Yes.
Okay. So again, here another point that we were just trying to establish is usually along with men's mental health, we see also men's dental health to be not taking the priority
Absolutely.
as compared to the other gender.
You can also correlate, building up self-confidence, building up, having a self-esteem, and it is nothing like everything comes after age of 20, 25, 30 when you are in the profession. Everything starts early. All right, so kids who are not able to speak up, I think my teeth are not well. So as you were saying, do men suffer more? Yeah, it may start early.
Right.
I am a dentist, but it may start early.
Correct.
I am no one to speak about mental health,
Right.
but there's a possibility. It is one of the
Yes,
factors.
I would definitely agree with you on that point. The aspect of confidence, especially if you just overlook everything else and just focus on the confidence part, people become very conscious when they are talking or when they are smiling, when they know that they have crooked set of teeth, or they have some sort of stain on their teeth, or they have some sort of dental problem. They become very conscious while talking to people, and the entire concentration or the focus is just on the fact that how am I looking right now.
Yes.
So I personally feel, yes, your dental health or your entire perception of your teeth that you have plays a major role. I have known, and for a fact, even I am one of those who feel a little conscious when it comes to this, because you've been my dentist, and you know I have not very straight set of teeth. Irrespective of the potential you have, irrespective of the profession you are into, this definitely keeps playing on your mind.
Yes.
Okay, and then subconsciously, knowing or unknowingly, you try to find solutions or ways to kind of, superficially come out of that particular
Correct,
problem.
correct.
Yeah. So, what would be your advice to people or parents who have not been taking their kids or their dental health that seriously?
So that it all boils down to again the same thing. Visit your dentist every year. So if at all we see, so when you say visit your dentist, take your entire family as well.
Right.
Yeah, have a general dental checkup for everybody. Okay,
Right.
health first, appearance second. Of course, दांत है तो अच्छे दिखेंगे, दांत नहीं है तो दिखेंगे ही नहीं.
Correct.
है ना, तो health first definitely, but then if there are some parallel problems, like okay, I think the appearance is also it can be improved. It may change how you look, how you smile, because some after 2 decades it may be a professional requirement. Who knows?
Correct.
We don't know what these kids are going to become. Okay?
Right.
It may or may not be a profession, and forget about professional requirement. Day in, day out, when you're sitting down, chatting, talking, it's a better, the acceptance is always better.
Dr. Tejas, a lot of information that you have shared with us. Now I want to ask you certain topics which are very common and something that probably none of us have great knowledge on, but we are just following the world and following what some people are doing, and randomly, blindly following things. One of them is electric toothbrush. So what is your take on that?
Actually, I really enjoy talking about this because a lot of patients ask me, shall we use electric toothbrush? Or, these are the common questions. Which toothbrush to use? Which toothpaste to use?
Correct.
So now the most common question is which electric toothbrush to use. So the history goes back. The electric toothbrush was really introduced for people with difficult maneuverability, जिनका grip अच्छा नहीं था, जो अच्छे से पकड़ नहीं सकते थे. Especially patients with cerebral palsy, they don't have muscle strength, okay, or some syndromes. For whatever reason, they are not able to brush their teeth. So what electric toothbrush does is you just have to place it in position, and the brush will rotate, oscillate, and it will do the job. All right. So it is not a bad device. All right, but it is not that you are not going to brush well with your routine regular toothbrush. Again, back to square one, what we talked earlier, the 4 things that you need to do. Manual toothbrush will work equally well as electric toothbrush. It's a new thing, it's not a bad thing, but may not be required. Right. You can stick to your routine manual toothbrushes, and I think it will do the job equally well, or sometimes my personal experience better, because you are really putting in attention to what you are doing. When you are using electric toothbrush, maybe your attention is not so much to what you are doing.
Right.
All right. It's a possibility.
Right.
So when you are using manual toothbrush, you are really looking into where that brush is going and where it is reaching, and if at all there are any problems, there's a possibility you may realize it a little earlier than otherwise.
So basically, there are no great advantages as compared to a manual toothbrush that an electric toothbrush has.
I don't think so, unless you are really busy and you have too many things to do. Yeah, one hand you have reading a newspaper, another hand everything is going on. You're so busy that you really don't have time to brush those 2 minutes. Maybe those patients,
otherwise
maybe those
not
people.
required.
Otherwise, I don't think so.
Perfect. The other question that comes to my mind right now is, I've heard a lot about this fluoride treatment.
Correct.
So what is fluoride treatment? Is it required?
It is a very important preventive treatment.
Okay.
All right. So let's call it as not as a treatment. Let's call it as a practice. Something similar to vaccination. All right. Like vaccinations are given to prevent the diseases. All right. Prevent crippling diseases. So when we do this fluoride treatments, we advise it earlier in life, wherein the teeth are nascent in the mouth. It can be done for later in life as well, or for some other patients with some specific dental problems. Now, what fluoride treatment does is it makes the layer of the tooth, which is called as enamel, a bit stronger and resistant to decay.
Okay.
right? What happens is the bacteria, they feed on food products that you consume. Their waste products are acidic. This acid melts the tooth.
Right.
So what fluoride does, it makes it resistant to this acid attacks.
Okay.
So it is one of the important preventive treatments.
How would you advise a person to undergo for these treatments? Is there any particular eligibility criteria for a person to go? At what age?
Everybody can do it.
Okay.
Everybody should do it. All right.
Okay.
Early in life, specifically earlier in life. So there are two things actually. There is one fluoride treatment, and I will add to it, there are something called as Pitt and Fisher sealants.
Okay.
Okay, so your teeth are not geometric, they are not cubes, they have some shapes, they have something like cusps and dips. So those dips meet into fissures. Now these fissures are where most of the times decay starts occurring. So you put those sealants, okay, which are also fluoride incorporated. So
Okay.
they become resistant structures.
Okay.
So you are prevented from cavity, but it's not again a substitute for brushing.
Right.
It is an additional,
An
preventive
additional
method.
step that can help you
Yes.
go for a longer run.
Correct.
Okay. And now coming to a topic which is very common, which is bleeding gums.
Yes.
How serious is it?
So you can say it's quite it's serious. Okay, there is nothing like is it very serious or it is less serious. It is serious. The fact that your gums are bleeding means there's a starting point. If you see it the first day, there is some swelling somewhere in the gums, in the mouth. Most of the times it is very difficult for patients to figure out where it is coming from. All right, unless you are having bleeding gums everywhere. All right, so the fact that you are seeing blood in your spit, that means there is some bleeding happening from somewhere in the mouth.
Right.
Now, bleeding gums means swollen gums. Any swelling anywhere in the body is not a healthy sign.
Correct.
Yes, so the fact that you see bleeding gums means there is some problem existing either in the gums or sometimes in the tooth. Like if the tooth is rotting, right, it will cause gums to swell up. Okay, again it will bleed. So there is some problem at some degree is happening somewhere in the mouth.
It needs to be addressed.
It needs to be addressed as early as possible. See, these are never emergencies, but don't wait for emergencies to occur.
Correct.
Yeah,
Don't
these
wait.
are initial signs. Till the time these emergencies occur, many things have been lost.
Right.
Okay, and you cannot go back in time then. Things which are lost are irreparable sometimes. All right, we can only, what I would say, we as dentists, we do repair work. We cannot regenerate it.
Correct.
है ना, जो डैमेज हुआ है हम उसको सिर्फ रिपेयर कर सकते हैं. हम नया बनाना, we cannot compete with God. Very simple.
Obviously, yeah.
We are trying to mimic, we are trying to replicate. We may be efficient to maybe 90%, but not as efficient as what he has given.
There is this concept that you had introduced me to when I had visited you once, which is referred pain. And something that we had an argument on, where I couldn't understand this concept when I came to you with a problem which I felt was in one part of my tooth, and you told me no, that is not the problem. So what is this concept? Because I believe a lot of us do not understand what is referred pain.
So it happens very commonly in these dental structures, that the starting point of pain is one area and the mirroring of that pain is in some other area. That's what is called as referred pain, and very commonly it happens it will never cross the midline. Basically, if you are having trouble in right, it will not happen in left.
Yeah.
But it may happen that you are having pain in one tooth and it may be referred to the other tooth. All right. Or it may be referred to the opposite jaw. Like you are having trouble in the upper jaw and you are telling me my pain is in the lower jaw.
Correct.
All right, so that's what we call it as referred pain. That happens also because each tooth has got sensation. All right, so they have a common set of nerve. Now those upper teeth will have one nerve, lower teeth will have one nerve. Those both of them go and meet at one junction and go to your spinal cord, brain, and all those things. So the input signal, okay, जहाँ से करंट जा रहा है वो एक तरह से जा रहा है, लेकिन वापस आने के टाइम पे कहीं और आ रहा है.
Correct.
This is what is called as referred pain. So it's really it's not an art or anything, but it's up to us to figure out where it is coming from.
Correct. And this a person can only figure out once he's visiting the dentist, because what happens is when we stick around to the home remedies, number one, कि हमें पता ही नहीं पेन है कहाँ, हम वहाँ पे लौंग का तेल लगा रहे हैं, we are putting all basic जो हमारी दादी नानी के नुस्खे होते हैं, we are putting some sort of medication on one tooth, but that is not the problem. The problem is something else. The root cause of the entire pain that you're facing is something else that I think is best sorted once you visit the dentist.
I'll tell you what, Firdaus, this DIY thing, it is fantastic in everything apart from your health.
Health, correct.
Yeah, you see there are some stores also, DIY stores.
Right,
It is
right.
fantastic. Like, do it yourself.
Correct,
It is
correct.
possible. Even if you make mistakes, you are able to, correct it, redo it.
right.
But once it comes to your health, you do DIY, time and some structures are lost, which you cannot get back.
get it
So
back.
DIY with your health, dental, mental, or anything, okay, it's not a bright idea.
Not a bright. So now another common problem that we all face, and which is a huge thing that many of us are seeking some solutions to, or the reasons, which is bad breath. So how does and how deeply is it rooted and related to your dental health?
It is vastly distributed. Okay, the more common bad breath origins are patients who are having sinus issues, sardi khasi hai, okay, or people who are having a lot of acidity, or the diet that you consume, कांदा लहसुन ये सब जब आप बहुत खाते हो, and you may have it may be perceived as bad breath. All right, for your mouth to give bad odor, it really requires a very bad gum health. All right, or a possibility that there's a cavity which is lodging food which is rotting. All right, that can give bad breath. So there are many things which can give bad breath. More common being, as I said, cold and cough. Yeah, having acidity issues. These are very common causes.
Okay,
Dental problems do cause bad breath, but the severity for you to reach that bad breath situation, you have already faced pain. So
Right.
I would say more patients who are having cold and cough will be having bad breath than having dental issues who will be having bad breath.
And what would be your suggestion for just if we need to understand? I mean, of course, catering to your cold and cough is one solution, but as a dentist, what would be your solution if somebody complains of bad breath?
Trying to figure out where it is coming from. See, if there's a disease, then you treat that disease. This is like a gum disease, okay, which is so severe that it is causing loosening of teeth. So those are active gum diseases. All right, so attend to those problems, and your bad breath originating from your teeth will go away. Or as I said, if there's a rotting tooth, all right, maybe possibly we have to remove the tooth, all right, or possibly you have to do root canal and restore it by putting some structures, crown, permanent restorations. So that will eliminate it.
Right.
So handle the problem, which are causing this trouble.
Okay. So, isn't mouthwash directly related to bad breath? Because that's what we've been seeing in the advertisements. If you have bad breath, gargle your mouth with a mouthwash, and that's how you solve it.
So the reason for me to advise mouthwashes is for general maintenance of your oral hygiene.
Okay.
It's not a substitute.
Okay.
It's a maintenance of your oral hygiene. So if you're having some food lodgement, the mouthwash is not going to take care of that cavity.
Right.
It's never going to take care of that cavity. It is going to keep on damaging.
Right.
So you may have a temporary feeling that I think my breath is okay, but the problem is still continuing. So and if you see a lot of advertisements, they are suggestive. They are never to the point. They are all advertisements are always suggestive. You do this, maybe you will be fine. But the description of problems are so variable. So it is very difficult for you to take a decision. I think I am having bad breath. My mouthwash is going to solve this problem. Not always.
Also, they say that how important is cleaning of your tongue as a part of your brushing activity?
The microorganisms or the bacteria and all the food debris which deposit on the teeth, at microscopic level, they also deposit on tongue as well. So cleaning tongue also becomes very important because you're not cleaning them enough. You're not cleaning your entire mouth properly. So after your brushing is done and you're not clean your tongue, right? There is some colonies harboring somewhere else. They are also again going to start growing. So having a good steps to clean your tongue, okay, cannot be ignored.
Sir, is it possible for you to help us understand what is the right way, just in a brief, right way to have the correct brushing done, or the motions, the circulation, as we say, you should be in a circulation for a circular form, and what would be the best steps to be taken?
So it's a reflex or has been just adapted by everybody to scrub the teeth in horizontal fashion, but our teeth are not, as I said, geometric. They are circular, they are having concavities and all. So having a circular motion is more effective. Easily said is just see to it that your brush is in contact with each and every tooth structure,
Right.
each and every tooth surfaces, I mean. All right, and the only surfaces which are not going to be able to be reached by brush is the contact areas where the two teeth meet. That's when floss comes into picture.
Right. That's when you need to get into the
Yes,
flossing
yes.
aspect. And now we come to one of our favorite topics, which is the importance of wisdom tooth.
Yeah.
Does it really have any importance? And as they say, you get wiser when you get your wisdom tooth. What is the science? What does the science say about it?
So it is assumed that people get wise by the age of 18. That's when your wisdom tooth erupts.
Correct.
That's why the name it's called as wisdom
Wisdom
tooth, or more commonly third molar. So they have very less function. Actually speaking, they have very less function, less than 5% in chewing, even if they are in complete position. Very less function in eating. Amount of force over there is also very less. So they are not really serving lot of purpose.
Okay.
All right. So if they start giving trouble, or they are in a position of giving anticipated trouble, so it is best to get rid of them.
So basically, as they say, with the when the wisdom tooth comes, आप और wise हो जाते हो. अगर निकाल दिए तो बेवकूफ हो जाओगे. ऐसा कुछ नहीं है.
We'll just remove them and give it to you back to you. Keep it in your purse.
So basically, they do not really
No,
serve
no,
any purpose, and it doesn't go by the name of wisdom tooth.
No.
So, Doctor, coming towards the end of our podcast, there are three myths that I don't know. You tell me whether it is a myth or not, but something that we usually हमें सुनने में आता है. Number one, what is your take on कि अगर tooth extraction हुआ, आपने दांत निकाला, तो आपकी आंखों पे भी असर पड़ता है उसका?
Biggest myth, मतलब ऐसा कुछ होता नहीं है. ऑलराइट, कि दांत निकालो और आपकी आंखें ख़राब हुई, इट्स एब्सोल्युटली अनट्रू. ये एकदम हाउ इट स्टार्टेड वी रियली डोंट नो. हमें पता ही नहीं है ये ऐसा मिथ चालू ही क्यों हुआ है, क्योंकि आंखें और दांत अलग स्ट्रक्चर्स है. आपका ऊपर का दांत निकाले तो नीचे में भी बहुत ऐसा तकलीफ है. ऐसा कुछ भी नहीं है कि आपका नीचे का दांत खराब होगा जस्ट बिकॉज यू हैव रिमूव दैट टूथ राइट नाउ. उससे आंखें खराब होनी तो बहुत दूर की बात है. तो इट्स अ बिग मिथ.
इसका कोई ताल्लुक नहीं है आपके दांतों का, आपकी आंखों से कोई ताल्लुक नहीं है.
कोई ताल्लुक नहीं है.
सो इट इज डेफिनेटली नॉट समथिंग.
ये अलग स्ट्रक्चर्स है, उनके सारे चीज़ें अलग है. एक चीज़ निकालने से दूसरी चीज़ खराब होगी, ये होने नहीं वाला है. दिस इट्स नॉट गोइंग टू हैपन.
Second myth that we usually have, or second confusion that we have is, अगर आपने आपकी wisdom tooth निकाली तो आपके बाकी के पूरा structure खराब हो जाएगा या आपके दांत हिल जाएंगे, दूसरे दांत हिल जाएंगे.
अगेन मिथ बस्टर, ये ऐसा कुछ होता नहीं है. विजडम टूथ निकालो और बाकी सारे दांत खराब हो, इट डजंट हैपन. इनफैक्ट आप विजडम टूथ छोड़ के दूसरे दांत निकालते हैं तो अरेंजमेंट थोड़ी बहुत चेंज होने के चांसेस है. बट विजडम टूथ इज़ द लास्ट टूथ. वो निकालने से आपके बाकी सारे स्ट्रक्चर्स खराब होंगे, ऐसा नहीं होता है. ये नहीं हो सकता है.
Okay, another reality check over there. Wisdom tooth निकालने से कुछ नहीं होता है. ना आपकी wisdom जाती है और ना आपके बाकी के दांतों पे.
wisdom tooth पक्का नहीं जाती है.
Correct. And the last one that I want to understand over here is the difference that usually people have. Many people believe, काफ़ी लोगों का मानना होता है टूथपेस्ट में बहुत सारे केमिकल्स होते हैं, उससे अच्छा है आप दंत मंजन या टूथ पाउडर यूज़ कीजिए. सो व्हाट इज़ योर टेक ऑन द डिफरेंशिएशन ऑफ दीज टू?
एक्चुअली दंत मंजन और टूथपेस्ट अगर हम कंपेयर करें तो टूथ पाउडर में ज़्यादा अब्रेसिव्स मतलब उसके जो पार्टिकल साइज है थोड़े बड़े हैं. सो दे विल कॉज मोर फ्रिक्शन ऑन द टीथ. उससे दांत ज़्यादा घिस जाएंगे. तो डेफिनेटली नॉट टू बी यूज. टूथपेस्ट डेफिनेटली टू बी यूज. केमिकल्स ज़्यादा है लेकिन आपको उसको कंज्यूम नहीं करने हैं. आप टूथपेस्ट खाने नहीं वाले हैं, आप क्लीन करके उसको स्पिट कर देना है.
करेक्ट.
आप कंज्यूम करते हो तो ये सारे केमिकल्स आपके लिए डैमेजिंग हैं, लेकिन ये रिकमेंडेशन ही नहीं. आपको टूथपेस्ट यूज़ करके स्पिट आउट करना है.
करेक्ट. बोथ इज सेम.
केमिकल्स पाउडर में भी है, बट अगर दोनों में हम कंपेयर करें तो टूथ पाउडर फिजिकल डैमेज ज़्यादा करती है. तो आप टूथ पाउडर से ज़्यादा टूथपेस्ट यूज़ करेंगे, ये बेटर है. सर, माई लास्ट क्वेश्चन ओवर हियर इज, व्हाट इज दिस कॉन्सेप्ट ऑफ ऑयल पुलिंग एंड हाउ डज dentistry or the dental science support it? एक्चुअली देयर इज़ नो सपोर्ट फॉर ऑयल पुलिंग. मुझे काफ़ी पेशेंट्स भी पूछ चुके हैं और मेरा एडवाइस ऐसा है कि आप कर सकते हो. आई डोंट नो हाउ एडवांटेजेस दे आर. इससे कुछ फ़ायदा है पता नहीं है, नुकसान पक्का नहीं है. ये आप कर लो, कोई प्रॉब्लम नहीं है, लेकिन इसके पीछे कोई विज्ञान नहीं है. देयर इज़ नो साइंस टू इट. ऑलराइट, देयर इज़ नो साइंटिफिक एविडेंस कि ये करने से ये ऐसा होगा.
Right.
आप ये करेंगे तो आपको कैविटीज़ नहीं होंगे, आपके गम्स अच्छे रहेंगे, कोई एविडेंस नहीं है। लेकिन ऐसा है कोई लोग प्रैक्टिस कर रहे हैं, कुछ नुकसान नहीं है, ओके फाइन, बी हैप्पी।
So thank you so much, Dr. Tejas. That was a wonderful podcast that we had.
My pleasure.
Many valuable information shared. So, as an ending note, if you would have to advise, or if you would like to end this conversation for my viewers and my listeners on the topics dental health and mental health, what would that be?
So dental health actually very easy, right? The first statement जो हमने शुरुआत में ही बताया था कि 2 बार ब्रश करिए, ओके, ब्रश ट्वाइस, फ्लॉस यूज़ करिए, यूज़ अ गुड माउथ वॉश, ओके, एंड विजिट योर डेंटिस्ट। आपके जो रेगुलर डेंटिस्ट है उनके पास आप रेगुलरली विजिट करिए। ये स्टार्टिंग था और यही एंडिंग है, ओके। डेंटल प्रॉब्लम्स बहुत कॉम्प्लिकेटेड होते नहीं हैं, इसको कॉम्प्लेक्स होने दीजिए मत, ओके। सीधी बात है, स्मॉल प्रॉब्लम्स स्मॉल सॉल्यूशंस, ओके। तो हम इसी पे फोकस करेंगे तो डेंटल हेल्थ बहुत कॉम्प्लेक्स है नहीं, ईजिली सॉर्ट आउट कर सकते हैं। बट नाउ दैट यू आर आस्किंग अबाउट मेंटल हेल्थ, ये थोड़ा कॉम्प्लेक्स हो सकता है इफ़ इग्नोर्ड। एंड ऐसा है कि एज यू आर सेइंग कि मेन टेंड टू इग्नोर, हम ऐसा चाहते हैं कि दिखाना चाहते हैं कि शायद से द स्टेटमेंट मर्द को दर्द नहीं होता, ये बहुत ट्रू है नहीं, ये सच है नहीं। एवरीबडी गोज थ्रू एवरीथिंग, मेन वेमेन इक्वली, सबको तकलीफ़ होती है, सबको दर्द होता है। स्पीक अप अबाउट इट, टेक प्रॉपर एडवाइसेस, मीट समवन, बैठ के बात करो, आपके डॉक्टर हो, साइकोलॉजिस्ट हो, फ्रेंड हो, बात करो, प्रॉब्लम सॉल्व होंगी, ओके। सो दैट्स माय टेक फॉर मेंटल एंड डेंटल हेल्थ।
Thank you so much. Thank you, doctor, for coming on this show. And if you resonate with the conversation we had today, make sure you hit the like button, the subscribe button, and also put your thoughts in the comments section. I will definitely put a link about Dr. Tejas's clinic and the services that he has to offer. If you like what he spoke and if you believe in the philosophies that or rather I would say if he's convinced you to believe in the philosophies that he shares, make sure you visit his clinic as well. Thank you so much for watching Men Unplugged, and see you on the other side. Thank you.
Damn.